we have our final speaker now. I'm really pleased to welcome Anita Gardner, who will be talking about advancing mental health for autistic communities, innovations and insights from the Oceanic region. Welcome.
Fantastic. It's nice to see people here still. I know lunchtime's coming up soon. My name's Anita Gardner and I'm from, well, a couple of different places. So I'm an adjunct fellow at the Western Sydney University and also work at the Sydney Children's Hospital, and they're both in the Darug Nation. I also work in the Garigal People's Nation as well on the Aurora lands, and that's part of Sydney, Australia. You might sort of recognise that there. And in that space I work as a psychologist. So I'm going to be talking a little bit today about what we're doing in Australia. I had to put Oceania on the abstract because you couldn't put a country, which made it a little bit challenging. But I really wanted to be able to highlight what we're doing in Australia. I also want to recognise that 20 years ago, it was a very siloed approach. It was very much people either worked in disability or mental health, and if you're an autistic person, you're experiencing any kind of mental health problems, and you went to the mental health practitioner, they'd say, oh no, you need to go to the disability people. And the disability people would say, oh no, we don't do mental health. So it's great to see that we've now really start to bridge that gap in Australia. We've got a long way to go, but we do now have a national roadmap that looks at mental health for autistic people, and that's been designed very much in co-production through the Autism CRC. So I'm going to be tapping into that a little bit as well. So in case anyone's thinking, is this for me, and you want to get an early lunch, I'm going to be looking a little bit about that stepped care model, a little bit about a program called the Feelings Program, which is, very controversial because we're talking about emotions and not just energy, as well as some tips about things that you could potentially embed into your practice. I'm also going to be talking a little bit about one of my fellow workers, a lovely man called Fletcher. He's an autistic young man. He also has a moderate intellectual disability. And when he first started, I guess, not so much working with me, at that point he was very much a participant who was a part of one of our projects. He was in a school. It was a support needs unit within that school, and schools across Australia all have very much embedded in those foundational supports, which is, again, universal for everyone, about wellbeing and having wellbeing really a part of that. He was also accessing what we call the NDIS. So the NDIS is the National Disability Insurance Scheme. It's a government-funded, huge project where we've now got over 600,000 people in the program. A third of them are autistic, and I did sort of get the maths on how much that would be in euros, but I won't pull that up now. But it's a decent package that people are getting, and people can individually choose what they're going to then use that funding for, which ideally is looking at being able to build a life that is a good enough quality of life, is the way that they describe it, and looking at functional capacity and personal individualised goals. And some of those goals can then help to be able to support someone in their environment to make sure that they do have the skills, that they are able to build supports around them to support their mental health. But it's not for mental health treatment. So that's the next level up in our tier. So mental health treatments, people in Australia can access through what we call Medicare. So that's, again, our insurance. That is, everybody has access to Medicare, and that helps to support bridging that gap a little bit. And that might be going to a GP, and then they can refer you on to an allied health professional. Often that might be a psychologist, mental health occupational therapist, a support worker. Then, of course, we also have those people who have really those high needs, and that might be that they're in an acute need of psychiatric assistance. It might be that they're having suicidal thoughts, suicidal ideation, and presenting to hospitals. So we have, again, another tier that just looks at that top tier. So for Fletcher, whilst he was at a school that had these foundational supports that's supposed to understand autism, instead what we were finding is that he was really being misunderstood in that space. He was getting the NDIS supports, but the family didn't really know what kinds of supports they needed to be asking for. And so when he presented to us, he was a young man who was describing himself as being like the Hulk. He'd just get angry really quickly. And his life was really starting to become very small. He was very, very angry about who he was and felt very bad. That idea of, talking about feelings as then making someone feel worse about something. I think that had certainly happened for him. But he hadn't accessed any mental health supports at that stage. Why? Well, he's not alone. In Australia, while we have this tiered approach and we have some really great ideas about it, we also have very high suspension rates and discipline from children as young as preschool all the way through their schooling. We see that autistic people are very much a part of what we call the school can't community. So there's an increasing number of people who are withdrawing from school, especially since COVID, and finding that that environment doesn't work for them. I was in a session recently today that was really talking about those pressures that people experience in that space. We see that there's an increased awareness, which is great, but that's also meant that we've seen an increase in the number of people who are being diagnosed and are needing those levels of support. We've got the high rates of co-occurring conditions in Australia, high rates of bullying, burnout, self-harm, suicidal ideation, and of course suicide as well. I think some of the issues that we really see, and I think these are across the board, overshadowing. And I don't just mean diagnostic overshadowing. So certainly for Fletcher, people saw he was autistic and he had an intellectual disability. So they really weren't looking to see whether there could be a mental health issue here. Now, for anyone who knew him beforehand, he was this happiest, really outgoing guy, but that was no longer the case. We've also got an issue with assessment measures, particularly assessment measures that are there for supporting autistic people with an intellectual disability. So I think there's a lot more work we need to do in that space as well. And there's some more out there for anxiety. There's some measures coming through now, but really not when we're looking at depression. So I think that's a concern. We do have a massive issue in Australia because of the NDIS. There's a huge demand now, and there's a real lack of supply for people being able to help across all the tiers. That's meant that we've now got a lot more people coming into this space, sometimes for the wrong reasons, chasing the money rather than doing it because it's their passion area. We've already heard so many people talking about the need to have individualised supports. It's not okay to have a cookie cutter modelled. And finally, we need to make sure that we've got really high quality professional training that's there at every single level. We need to make sure that schools and teachers and admin staff, that everyone there has that awareness of support and how to really help to build the well-being of an autistic person and how that might be different to other students in the school, and that's okay. So I think there's a lot of work that we can be doing. And at the Children's Hospital, we are doing more work in this space. So we have what we call the Feelings program, and that's again been co-designed. We use absolutely neuroaffirming approaches in developing the program as well. This image, you can see Fletcher there in the image standing in the middle. We recently were awarded the National Excellence in Consumer Partnership in Research for the work that we're doing in autism, intellectual disability and cerebral palsy. We also make sure that we embed in what we're doing universal design for learning principles. So that's again, we've heard it here today. It's not just about designing something that's just going to be for a child with a disability or a child who's autistic. We really want to make sure that this is something that everyone can benefit from. And finally, that iterative testing. It's not a case of saying, oh, we've got it now, that's great. We really keep going back to our research partners, keep going back to the people who are using the program and saying, how can we do this better? What else do we need to be able to do for this program? So what is the program? The Feelings program is the one that I'm talking about. It is an emotion-based skills program, and it does help people to be able to understand their own emotions as well as the emotions of others. It helps to be able to look at problem solving in a really scaffolded way and looking at those emotion regulation skills. And I was really excited to hear our other presenters today because I'm sitting there going, okay, that's great, This is really in line with what the research is saying. The program is done face-to-face in a group setting. And again, when you have other autistic young people talking to young people about their experience, it's fantastic to hear them going, oh, that's not just me, that's other people as well. So it helps them to feel heard and seen. We also have a parent component and a teacher component. So that double empathy problem, we want to make sure that they understand what this experience is like for their child as well. And it's not about telling everyone, oh, this is the way that you have to be happy, or this is the way you have to be worried. In fact, there's a lot of videos in the program, and when people are watching them, they sometimes get annoyed because they're like, that doesn't look happy enough. They should look happier in that video. And it's like, well, no, that's their happy. What does your happy look like? So we really want to make sure that we stop this idea that it has to be one particular way to say that you've got that emotional literacy. What else are we looking for? So we're really trying to build the empathy. Finally, it is positioned as a mental health promotion, so that early intervention stage in the stepped care model, but we do know that for people like Fletcher, he certainly benefited from the program as well, when he already had levels of anxiety and the depression that were in that clinical range. We used a lot of different tools in the program. I'm certainly not going to go through all of them now, but I think the real power of the program is that it's simple. There's a lot of repetition in the program, and ultimately everyone gets that shared language across home, school and clinics, and people start to understand emotions are okay. Emotions are a normal part of being human, and emotions are important because different emotions will tell us different things about the world that are really important for us to know. Is this something I should be worried about? You know, this other feeling that I'm having, what do I need to do in this situation? So we teach people things like problem solving in a scaffolded way. So that's an example of one of the problem solving sheets that we use for autistic people with an intellectual disability. Teaching them around flexibility of the different thoughts that you can have in a problem. It's not just one option. How are you going to feel in each of those options? What might happen next? And importantly, choosing then one of those, doing it, and then being able to review how did it go. Yeah. We also look at, you know, not just what a feeling is, but the intensity, because I think that's a really important part when we're talking about feelings. You don't just have it, it's how much of that do you have. So we do that as well. And we also talk about metacognition. So we teach in a very concrete way, in a program we call it cup characters, of what a thought is and what that looks like. Now, this is just one program. There's some lovely, great programs out there, I think, that really help to address this area and start to provide some grounding for mental health supports. Another one that I really like is Dr. Brenda Ratcliffe. And so you often hear grounding techniques, and a lot of autistic people will say, oh, I really don't kind of feel like I connect with that. So this is one, making it concrete. You know, what are things that you like to look at? What are things you like to smell or touch or sounds? You know, is it being wrapped in a blanket with a nice cup of tea? And being able to then say, when you're feeling dysregulated, think about your five-finger kind of, what are you needing? And then let's do those things. Let's combine those things together to help you feel regulated in a way that's real for you and validating for you. So when we're moving from research, we do a lot of research in this space, but also into routine practice. I guess some of the key things I wanted to leave you with was thinking about the language that we use, but also thinking about the communication preferences and, importantly, the interaction preferences of the people that we're working with. We've obviously heard a lot about the sensory needs and interests as well. And all of those things help us build rapport and also help us to be able to co-regulate in those situations. I think it's important that we do look at bottom-up and top-down approaches and blend those and not just exclude one from the other. It's important that when we're doing work with a client, I make sure we plan those sessions. We're really explicit about what we're going to talk about and why that's important. And finally, we need to make sure that in Australia, as a psychologist, that we're also keeping update with our competencies. So they've just included new competencies in Australia that every psychologist needs to have a neurodiversity affirming approach. They need to understand what that approach is, and that also needs to include how do you work with someone with alternative and augmentative communication. So key takeaways, co-design is a fantastic thing. Research is important, and we still need to continue doing really good research, which is co-produced research. And we need to make sure that everybody here can start by making those small steps, because as we heard earlier today from Bernadette, those small steps make a difference to being able to create better outcomes for everybody. So that's me done. Thank you everyone for your participation and staying, and I'm going to see if I can get this right. Goroma agut. How did I go?
It sounded fantastic to me. Thank you so much. Can I just ask one really quick question? Because I love the idea of this kind of peer group, but often in peer groups, there's not always a sense of diversity. And I wondered, are a wide range of young people encouraged to take part in these?
Yeah. So the Feelings program, some of the research that we've done is in our autism schools in Australia. And so, you know, when we've got it into that level of school, everybody's kind of a part of it. And that, I think, has been a really valuable thing to say, this is not just something that you have to identify there's a mental health need, because at that point it's too late. It really needs to be in an earlier level and built into, where possible, schools.
So I see we have one question, if we can take that very quickly.
Yeah, perfect. I'm an occupational therapist working in a children's disability team here in Ireland, and I think we're very much in the position you said Australia previously was, with mental health services not accepting children with autism or autistic kids because they're autistic, and then the disability services not meeting their mental health needs. I know you mentioned a roadmap that the government came up with. Do you have any other practical ideas about how you are bridging that gap? Because we're really stuck.
Look, I think one thing that's really helped us is the Discrimination Act. So the Disability Discrimination Act and people are actually realising that it's there and that that's an important thing, and that allied health professionals are not able to sort of say, oh yeah, but I can't. There are competencies, absolutely, but for those peak bodies to start to say, actually, no, we're building this into your competencies now. It's no longer okay for people to say, oh, I don't do that, because it's like, you know, there's no other area where you'd say, oh, well, I can't see women because I only see men. So I think really making sure that people realise it's no longer optional.
Brilliant. I'd like you to all join me in saying a huge thank you to all of our brilliant speakers this afternoon. It's been a fabulous session and I've really enjoyed it. Please do enjoy your lunch, or you're very welcome to stay for the lunchtime session on the role of businesses in building autism accessible workplaces and society. Thank you very much, everyone.